DPIs seem easier to use compared to metered dose inhalers. There certainly are fewer steps and less hand-to-lung coordination required. But unfortunately, incorrect technique with DPIs impairing drug delivery is still too common. For example, in one study, 17 to 33% of patients did not use the aerolizer properly. In another study, poor technique was as high as 71% with some DPIs. Improper technique is not just a theoretical problem. While some studies show some slight differences, poor technique is a significant issue across all of them. Poor technique has been correlated to an increased risk of hospitalization and urgent care visits, more frequent courses of oral corticosteroids and antibiotics, and poor disease control. Researchers have found associations between poor device technique and older age, fewer years of schooling, and lack of instruction by healthcare providers. The problem of poor technique is not confined to those with just these risk factors. Lack of instruction by healthcare providers is a significant contributor to poor technique in all patients. It is important to show each patient how to use the device, to observe their technique, and to provide feedback. Let's review some of the common errors to look for. The first issue is the patient perception that they are not receiving any medicine from their DPI. This could be a misperception based on their experience with quick relief medicines in metered dose inhalers. They are expecting to feel and taste the puff of propellant. So when they don't feel or taste anything after inhaling from a DPI, they think they are not receiving any medicine. Because they don't experience immediate improvement with their DPI controller as they did with their quick relief inhaler, they think the DPI medicine does not work. But before you provide routine assurance that they are receiving medicine, you should observe their technique. Here are some common errors that would impair drug delivery. The patient may not be loading the dose correctly. This includes forgetting to place the capsule in the compartment, also using an empty capsule by mistake. Not piercing the capsule. No medication will be inhaled. Also, patients should never pierce or puncture the capsule more than once. Patients need to be sure to release the piercing buttons once depressed. This will ensure the capsule can freely rotate. Opening a capsule from the foil pouch prior to placing it into the correct chamber. Swallowing the capsule. It is meant to be inhaled. Patients should be reminded to only use capsules that come with each device. Do not mix unit dose capsules that have come with other devices. If the capsule does not vibrate, gently tap the base to release the capsule. Do not press the piercing buttons again to loosen the capsule. And finally, some patients may be concerned about inhaling small pieces of capsule fragments. If this happens, patients may be able to feel them on their tongue. It is not harmful if these pieces are swallowed or inhaled. These fragments are tiny and the gelatin will dissolve in the lungs. Specific to the HandiHaler, patients are instructed to inhale 2 times for each capsule to ensure all dosage is inhaled. However, if patients routinely notice through the medication window that they have inhaled all the powder on the first inhalation, a second inhalation may no longer be necessary. The next set of problems is related to loss of the dose before it can be inhaled. For example, shaking or tilting the devices after piercing or loading the dose. Exhaling into any of these devices after the dose is ready could cause the dose to be lost. There are several issues related to inhalation technique. Not exhaling first prevents taking a deep maximal breath. Patients need to create a tight seal around the mouthpiece to generate the necessary inspiratory rate for the drug to reach deep into the lungs. Covering the air vents of the device during inspiration could also make it difficult to breathe in quickly. Inhaling too slowly or shallowly will also decrease the amount of drug reaching the lungs. If an inadequate inspiratory rate is suspected in a patient, the in-check dial might be helpful. We discussed that tool in another video in this series. On the other hand, inhaling too quickly causes more of the dose to impact the back of the throat and be swallowed. The next issue is an inadequate duration of breath holding. inadequate breath holding will maximize the amount of inhaled drug particles that settle in the lungs. While observing the patient, count how long they hold their breath afterwards. 10 seconds is what is recommended. However, patients with moderate to severe COPD may be tachypnic, even at rest, and find breath holding very difficult. The ideal duration for breath holding is not known. Until further is known, encourage at least 5 seconds, and for patients to continue to practice a longer breath hold. If a patient has difficulty with even 5 seconds, another device may be needed. DPIs require little maintenance. Properly closing or recapping the device decreases the risk that the patient will inhale dust and particles. Double check that patients are aware and can read the dose counter on the pressair device. It counts down by 10 and is quite small. However, it does turn red when only 10 doses remain. If a patient is colorblind, they may have difficulty distinguishing between the red and green control window, which signifies that the dose is ready and that a full dose has been inhaled. There are some other potential patient-specific factors to consider when choosing the best drug delivery device. If a patient is very familiar with a particular device, changing to a different device can be confusing. If a patient has been documented to have good technique with one device, it can be helpful to stick with that device. For example, even slight changes in technique can be confusing for those with low health literacy or those who are easily confused. Another factor to consider is the age of the patient. The aerolizer is the only device approved for a pediatric population or children at least 5 years of age. It contains a long-acting beta agonist and shouldn't be used as monotherapy in pediatric patients. The HandiHaler, NeoHaler, and pressair all contain medications for COPD and are therefore only indicated for adult patients. This may be related to the indication for the drug formulation rather than any age-specific device issues. Very elderly or those with very severe airway obstruction also may not be able to achieve the required flow. We have talked previously about the importance of generating the necessary inspiratory rate. For these devices, at least 30 to 60 liters per minute is necessary to produce the desired respirable-sized drug particles. The aerolizer may require a higher rate compared to the HandiHaler and pressair. If patients have minimal hand dexterity, the pressair may be a sound choice, as it doesn't require a capsule to be pierced, but simply depressing the green button to load a dose. Similarly, as stated earlier, if patients are colorblind, the pressair may not be the best option, as it requires that patients be able to distinguish between the red and green dose indicator window. The aerolizer, NeoHaler, pressair, and HandiHaler all contain lactose. In the uncommon situation of a patient with severe lactose intolerance, switching to a different device, such as the discus, may be a better option. In this series, we will only include device issues. Please remember that there are also potential differences between drugs in the same class. For example, once versus twice daily dosing and adverse effects. Availability of insurance and formulary issues will also impact the selection of a specific drug product. Although the technique for DPIs is simpler than that for inhalers, poor technique is still very common and results in poor disease control. It is important that patients are initially instructed by a healthcare professional. Actually observe your patient's technique and provide feedback. Technique should be rechecked and documented periodically to ensure that patients receive the full benefit of the medication. Healthcare professionals should know the key features of and differences between the different devices and be able to select and recommend an appropriate device for a specific patient. Remember, as a healthcare professional caring for patients with pulmonary diseases, device counseling is an important responsibility that lies with you.